Women in rural areas risk maternal child mortality amidst COVID-19. The COVID-19 pandemic is making it increasingly difficult to access adequate maternal and child care in some rural areas of Kano, thereby risking an increase in the rate of maternal and child mortality amidst lockdown restriction movement across the state. Although rural Kano does not have many confirmed positive COVID-19 cases, factors such as financial restriction, psychological tendency, mobility, and access by law enforcement operatives are obstacles faced by pregnant women and nursing mothers in a bid to get maternal health care. Nigeria has the fourth highest maternal mortality rate in the world after Sierra Leone, Chad, and South Sudan, with about 914 deaths per 100,000 live births, while Kano, with a population of about 15 million, has 576,000 deaths per 1,000 live births, and a child mortality rate of 103 deaths per 1,000 live births. With the prevailing barriers in accessing care, non-figures of death per live birth are likely to increase. Some pregnant women and nursing mothers who spoke to the reporter at the Mariri Primary Health Care Center, Kumboso local government area of the state, revealed that transportation, among other obstacles, is indeed a challenge. One of the nursing mothers, who confirmed that she came from Farawa on foot, admitted she almost gave up under the scorching sun. Another pregnant woman, who came all the way from Tudun's Amia on foot, said, "I suffered a lot while coming, especially with the fasting. I seriously felt like going back." So you can imagine the number of women who may have been put. Speaking to this reporter, the officer in charge of the antenatal care at the Mariri Primary Health Center, Aisha Ibrahim, confirmed that the rate of women coming for ANC at the center has drastically reduced since the pandemic. Hospital deliveries are fairly okay compared to ANC, where only 1 out of 10 women now. Also speaking, Aisha Ibrahim Shehu, an ANC staff at the Bunkure Primary Health Center, confirmed that apart from the fact that other clients are consciously staying away from the public due to coronavirus crisis, many of them lack mobility to bring themselves to access healthcare at the primary health center. Before, we used to get between 70 to 80 clients in a day, but today we barely did 26 as reflected on our register. So because of those who are head of the department at the Mariri Primary Health Care, Mahmoud Umar, who decried the decrease in the rate of women attending ANC at the hospital, said it is not unrelated to fears of clients that they may contract the dreaded COVID-19 virus when they mingle with other patients at the hospital, or the mere thought of them that primary health workers may not be at work as a result of the ongoing health sector crisis. Before the crisis, we used to log in between 70 to 80 attendants per day, but that number has drastically reduced today. And I'm sure it's due to concerted efforts in putting in place preventive measures and creating awareness. Salisu Ahmed Adamu, who brought his wife for ANC at the Mariri Primary Health Care, revealed that being the first time bringing his wife to the hospital, he faced challenges with up to 5 law enforcement officers who quizzed him on an embarrassing manner. This is enough to discourage others from coming because they sometimes hiss at you and humiliate you. At the Rano Primary Health Care Facility in the Rano local government area, apart from normal fluctuation in figures of clients, which is not directly related to COVID-19, women are still accessing maternal and child care in their numbers. However, due to financial constraints, there is a limit to the kind of services they can access at the PHC. While lockdown is an essential strategy to curb spread of the dreaded virus, many aspects of women's sexual health and reproduction are directly or indirectly endangered as they run the risk of losing their lives as a result. It is therefore important for government to re-evaluate lockdown protocols and allow for accommodation of certain measures that will ease the strain on women needing to access health care while intensifying aggressive contact tracing and isolation in order to defeat the pandemic in real time and return to normalcy. These measures should include adequate provision of personal protective equipment (PPE) for primary health workers, orientation for law enforcement agency on how to be civil with women and their spouses on the way to accessing healthcare, provision of direct complaint channel in cases of law enforcement excess, among others. There should also be concerted effort to intensify public enlightenment at grassroots level about the safety and precautionary protocols put in place at the PHCs to stem community spread of COVID-19. From Kano, Khadija Ishaq Bawas reporting for Liberty News.